President Duterte has extended the modified ECQ status of the NCR Plus bubble. But the IATF has yet to announce if more businesses will be allowed to reopen. Health experts are asking the public not to downplay mild COVID-19 symptoms. They're also warning that reinfection could lead to a more severe COVID case. A recent survey shows that distance learning is taking its toll on the mental and physical health of teachers. Retired Supreme Court Justice Antonio Carpio and former Foreign Affairs Secretary Albert del Rosario clapped back at President Duterte for blaming them for China's continued presence in the West Philippine Sea. And in sports, PBA officials say there will be no games until COVID-19 cases in the NCR Plus bubble go down. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Sean Yao. The government's COVID-19 task force is discussing the guidelines for the extended quarantine status. This includes which businesses will be allowed to reopen to help stimulate the economy. The NCR Plus, or Metro Manila, Bulacan, Cavite, Laguna, and Rizal, will once again be put under MECQ until May 14, so it is an extension of the MECQ status. Meanwhile, Santiago City and Isabela, Quirino, and Abra will also be under MECQ for the whole month of May. On the other hand, the list of areas under GCQ for the next month are now being flashed on your screens. The rest of the Philippines will be under MGCQ. The Trade Department has recommended to allow personal care services and indoor dining under MECQ. If permitted, Undersecretary Ruth Castello notes that capacity will still be at the minimum. The IATF has yet to respond to this proposal.
Probably that will enable them to retain the workers that they have and then at least go back or start the business. As soon as the IATF approves Secretary Lopez's recommendation, the DTI will issue a memorandum circular on this so that we can release protocols that businesses will have to follow.
Health experts are asking the public not to downplay mild COVID-19 symptoms, as these could still develop into a more severe infection. JC Cosico has the details.
Dizziness and fever were among the first symptoms Russell Pua felt when he contracted COVID-19 back in December. But as days went by, he developed a difficulty in breathing. It turned out he had pneumonia and later on needed oxygen support at the hospital.
Parang feeling, parang dire-diretso na, parang feeling ka mamamatay na ako, gano'n. Kasi umabot sa point na parang hindi ka makahinga and kahit anong inhale mo, hindi siya, parang walang pumapasok na air sa lungs mo.
That's why experts are asking the public not to take mild COVID-19 symptoms lightly, especially as mild infections have the lion's share of the country's active case count. Aside from self-monitoring, doctors are advising people to undergo early consultation.
Anybody who has COVID, especially with symptoms, should always be closely monitored because even if the rate of severe and critical is only 2 to 3%, pero hindi mo alam kung ikaw ba yung mag-severe and critical, mataas ang chance mo na mamamatay.
Dr. Solante says COVID-19 patients may avail of telemedicine services for guidance on what to do once symptoms start showing. The infectious disease expert also warns of extrapulmonary manifestations of the virus.
Pwedeng matama ng utak, pwedeng matamaan ang puso, pwedeng matamaan ang gastrointestinal tract, kaya may mga pasyenteng ang presentation inatake sa puso, stroke, or even diarrhea.
As for recovered COVID patients, Solante says they must also be cautious because it's still possible for them to be reinfected and develop severe symptoms.
Pwedeng malala, pwedeng mild, pwedeng moderate, pwedeng maging severe, pwedeng maging critical. No? So, Hindi natin alam kung lumalala, basta pwede lahat mangyari pag reinfection.
In the end, health experts are calling on everyone to get vaccinated to prevent contracting severe COVID-19. For News 5, JC Cosico, We Are One News.
And all eyes are on India as the South Asian country continues to grapple with the worsening COVID-19 situation. Let's take a look at what went wrong and how India can bounce back from what the World Health Organization describes as a perfect storm. Let's watch this video from Bloomberg Quick Take.
So it's like a perfect storm in India. It's a combination of poor leadership, a lack of public health infrastructure. It's almost an entirely privatized health system, which means that so about 80% of care is provided in the private sector. So whatever public data surveillance they've got is not representative of what's really going on in the country. The leadership has been reluctant to use lockdowns and has been actually recommending against lockdowns. The other issue is we have these variants of concern. So there's several different variants circulating in India, but also this new Indian variant. And we're hearing reports of young people in hospitals and that it's different from the last wave, etc., that there's more young people. Without proper surveillance data, which they just don't have, it's really hard to get a handle on that. There's like a lack of consideration of how to manage all the undocumented workers and that kind of very marginalized population, which is a substantial number of people in India. Really, India needs to develop their own self-reliance and capacity. They have the human resources, they have the technical know-how, they've got the manufacturing capacity. What's missing is the political will to make it happen. Probably lockdowns are the only thing that's going to help at this point. Universal masking and mask mandates, I don't think they're well implemented there, as in the compliance. And again, it comes down to political leadership. The second thing is to really ramp up the vaccination program, to make sure the supply is coming and do whatever it takes, whether it's to invest more in serum institutes so they can manufacture more, secure a supply of the raw materials, if that's the choke point, get vaccine from elsewhere. They should be able to ramp that up and get the vaccination program happening. Yeah, I don't think anywhere near the majority of the population's been infected, and we just have to look at Brazil to see that in places like Manaus, despite a majority of people getting infected in the first wave, they still got infected again in the second wave, and that's what, with these new variants of concern, that's the big issue, that, you could be susceptible to reinfection with a different variant, etc.
We're going to pause for a quick break, but we will be back with more stories after that. Stay with us. You're still watching One News Now. I'm Sean Yao. The COVID-19 pandemic has exposed the sad state of private hospital nurses here in the country, particularly when it comes to salaries. Jenny Dongon tells their story.
Rowena's daily routine includes checking on COVID-19 patients at the ward of the Mary Mediatrics Medical Center in Lipa City, Batangas. The 40-year-old nursing aide caters to almost 20 patients daily, from feeding them and changing their clothes to monitoring their vital signs and oxygen supplies.
Sakripisyo po talaga. Kasi yung pag-morning care, pag-vital signs, papalit ng bedsheet, sobrang, minsan tinamatagal ako minsan sa pasyente, pag na-rounds ko lahat nila, ako lang NA, minsan 15, 17 patient, akin lahat yun, monitoring. So pag nagkasabay-sabay po ang morning care, nabawa po yung 5, di yun po, medyo pagod ka po talaga kami kasi yung oras namin sa paglilinis sa pasyente, minsan inaabot po kami ng 1 oras at kalahati, ganun.
It's not any easier for intensive care unit nurse June, who tries to hold back tears while placing the body of a 70-year-old expired patient in a cadaver bag. These challenges do not exactly translate to sufficient salary. The Labor Department says the salary of nurses in the Philippines ranges from 27 to 47,000 pesos depending on whether they work at a public or private hospital. But data presented by the Filipino Nurses United show that private hospital nurses only get 10,000 a month on average, while public hospital nurses receive 22 to 32,000 pesos. Mary Mediatrix Medical Center Director Romel Lojo admits they cannot level their employees' salaries to the government standard due to financial challenges. Lojo says this is also the reason why they don't have enough manpower and resources to add COVID-19 beds. Since January this year, 17 nurses have resigned from the said private hospitals.
Hindi ka pwedeng maglalagay lang ng bed tapos lalagay mo dyan ng pasyente. Sino magbabantay dyan kung wala kang nurse? Kung halimbawa yung patient mo needs a ventilator or a high-flow nasal cannula machine, kung wala ka nun, anong gagawin mo sa pasyente? Kung wala kang medicines, like halimbawa yung mga ibang medicines ngayon, naubusan tayo ng stocks, the remdesivir and all of these medicines. At paano natin ititreat yan? So, hindi ganun kasimple ang maglagay lang ng bed.
To somehow ease their burden, the Batangas Hospital is appealing to PhilHealth to pay their COVID-19 claims worth around 50 to 55 million pesos. For News 5, Jenny Dongon, We Are One News.
Let's check out some other stories we're keeping our eyes on. Retired Supreme Court Associate Justice Antonio Carpio clapped back at the president for blaming the past administration for China's continued incursion in the West Philippine Sea. Carpio said it was Duterte who set aside the 2016 arbitral award to seek loans from the Middle Kingdom. For his part, former Foreign Affairs Secretary Albert Del Rosario said that the impasse with China was settled back in 2012. This is, of course, in regard to or regarding the Scarborough Shoal, but the Chinese government deceitfully breached this by not withdrawing its ships from the area. And a recent survey suggests that distance learning has negatively affected the physical and mental well-being of public school teachers. The ACT, or Alliance of Concerned Teachers, found that 76% of public school teachers in Metro Manila and 75% of all the other teachers outside the metro have experienced the adverse impacts of their duties. And Justice Secretary Menardo Guevara is leaving it up to the police to arrest distributors of anti-parasitic drug ivermectin. He explained that giving away ivermectin as a possible treatment for COVID-19 is, on face value, a violation of the Food and Drug Administration law. On Thursday, Congressmen Rodante Marcoleta and Mike Defensor distributed free ivermectin to around 500 people in Quezon City. In sports, the PBA's bid to start a new season will depend on the number of cases within the NCR Plus bubble. That is according to Commissioner Willie Marcial. And this was one of the topics that was discussed in his meeting with Executive Secretary Salvador Medialdea. Marcial said that cases in the bubble should go down first before the season is allowed to push through. And with this, the PBA is set to submit a proposal to the IATF to at least allow practices while games are not yet set. Batangas, or the province of Batangas, is being pegged as one of the potential venues to hold the practices.
Pag bumaba na yung cases, meron tayong appeal sa task force na nagbigay kami ng sulat by tomorrow kay ES Medalvea, katulad ng ginawa natin doon, para mapadala sa task force na kung baka pwede tayo magsimula ng scrimmages after MECQ.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.